Okay, Ryan, tell me what's going on.
Hi, my name is Ron. Having this low back pain. It's been going on for about 3 weeks now. That's gotten worse than just in the past 2 days. I've been getting a lot of pain usually when I run and I do a lot of lifting. I've cut down on lifting because it aggravates my pain, but even if I cut down on my weight, it still causes pain at my back.
So how much pain from 0 to 10 at worst?
At worst, I'd say about a 7.
7.
Yeah.
And do you experience constant pain?
With motion.
With motion?
I do have constant pain. More like a sore ache pain.
How much from like you feel it now?
Maybe like a 2 or a 3.
And which motion aggravated and how much?
I get most of my pain when I extend my back with somewhat of side bending.
Side bending
and then I do get more when I flex to the point where I'm starting to feel it's like my whole low back and the back of my legs are just pulling.
Okay, so we're gonna do this motion, and but before that, tell me what kind of treatment you had it before.
Haven't had any treatment. All I've been doing is just my regular stretches.
Okay, so you've been doing stretches. Yeah, what else have you been doing?
Foam rolling.
Okay.
I've done self massage about the roller.
Okay.
That's all.
Okay. So let's stand up. Okay. And I want you to do the motion that's aggravated. 1 second. Get me this. Or you can face me. Okay.
Just doing this here.
Okay, marking your legs how far you can go down without pain. So by your knees, a little bit over your knees, half, kind of quarter way. Okay. How much pain with that?
I'm like a 6 right now.
6. Back up. Any sharp pain going down to your legs?
None. But I feel like a lot of pulling. So
Pulling. Where is your pain in? Is it lower back or glute area?
Starting from like the upper glute area.
Okay. Okay. So it's radiating down a little bit on the right side when you come. Okay. And what other motion aggravated? Okay. Now you tie it this way. What about side bend the other way?
I don't have any of this. Perfect.
Okay. Let's turn around and do the side bend again. Facing me. So you feel that sharpening going down. How much from 0 to 10? Well, the other way? Okay, so it's more with flexion and side bend. Okay, so let's actually lie on your side. So it's more on the right side, yeah?
More like when I flex, it's on the right.
On the right side. Yeah. So I want you to face the window, lying your head this way. Okay. So let's get a gown, and we'll have you start using A1, A2 with him. So we're gonna get you a gown and a pillow. Okay. We'll put a pillow underneath his head. So everything we do here should be pain-free, okay? Okay. If you feel any pain with the treatment, make sure you let us know.
Got it.
And we'll change the maneuvers. So this is an instruction video, so we're going to show you how we use ASTR tools. Currently we have several patents on those tools. We're going to use it to release fascia restriction and the scar tissue. You're comfortable in that position?
I'm fine.
Okay.
No, I'm fine.
Okay. So we'll just do the assessment and do the release. Okay. It's more lower back. He was complaining of that. Usually around. Yep. You feel that? Yep. We visually can see that. And
I feel feel like a stretch, like pull.
Tightness, yeah. Visually can see the fascia restriction. Now Linda's using A1 actually to release the fascia, and you can see in the video actually it takes a second to release it. It does not take much time with the instrument. This instrument actually designed to help the practitioner to save their hands from pain, and also to do fast release. So tell us what you feel now with those instruments.
I just feel like a lot of pulling.
Pulling, okay.
Yeah, it's not painful though, but I can feel like like my tissue on the inside.
Like a stretching kind of.
Stretching out.
Yep. Any pain with that, or it's okay?
It's okay right now.
Okay. So I will get to the mid spine area, and he was complaining. Yeah, on the spine, the lumbar and thoracic. Yep, yeah, not thoracic much as lumbar, and closer to the sacrum. And it's radiating to the right glute, going down to your ischial tuberosity, or how far it goes down?
On my left, when I do the side bend, it goes from about the glute,
okay,
as far down as like halfway through my hamstring.
Halfway to your hamstring. Yeah. So we're gonna work on that. How's that feel, Linda? You can describe it to us. Yeah, it's tight.
It's tight.
Yeah, we can see it. It's but you're not sweating here, you know. Not yet. Okay. Okay, and after doing that, we're gonna do reassessment. You're gonna reassess the tissue, and then we're gonna do reassessment for the range of motion to see if change happened or not, and then we're gonna move on with the treatment based on patient presentation. You can use your hand if you need to, if it's area. Okay, let's look a little bit better. All right, let's stand up, and we're gonna reassess it with the range of motion and see if you feel any difference. Open the doors up. Okay, so I want you to bend forward and see how far you can go down. Any difference with that?
I can reach my socks.
Yeah, so you like a few inches down. Beautiful. Go backward.
What's the first and last name?
Does that look further?
Yeah, my spine just started cracking back in place, I guess.
Let's do the side bend, because you were complaining of the side bend while you are in the neutral position. Neutral position.
I don't feel anything.
You don't feel it? Beautiful. So no sharp pain going down.
There's like barely, but it's down here now.
Okay.
I think on my low back right now.
And when you did the forward flexion, did you feel any pain?
I feel a lot of pulling.
But
back down here.
But the sharp pain is gone?
Sharp pain is gone.
Beautiful. Have you ever been able to touch the floor?
Back in high school, like that's 10 years ago.
10 years ago. Do you want to do that today?
If I can. I will.
Okay, we'll try to get you there. Okay. So let's lie on your side again. Okay.
Same side?
The same side. Okay. So we're gonna cover him, and we're gonna actually use another ASTR instrument. It's called A3 and A4. We're gonna use that to release fibrosis, scar tissue, and we'll check the range of motion after that. And we'll put the gown on him too. And I want you to cover him while you're working on the glute. We're going to do the fibrosis in the glute area. And Elia, You're gonna be covered, you know.
No, it's fine. No worries.
No, it's and make sure it's pain-free, okay?
Yeah.
So cover him while you work and really get on the glute area. Are you comfortable that we work on the glute area a little bit?
That's fine.
Okay, so get the performance and glutes. Do you feel, what do you feel, Linda?
It's rough.
Okay.
It's some scar tissue buildup. I can feel it.
So you feel a lot of scar tissue there? Okay. How do you feel with those maneuvers? Yep.
I feel a lot of pressure. At the same time, when the tool is running, it goes over my skin. I feel like little balls. I feel like the tool is just like jumping over.
That's totally correct. Those balls, those are actually the scar tissue, the fibrosis. So because you have fibrosis there, the instrument kind of jump. It's not like going smooth.
It's not smooth.
Yeah. Would you show him like an area that he does not have a scar tissue so he can feel the difference? Hopefully he has a good area.
See how those bumps are popping up? Because that kind of.
Yeah.
So it's just so tight and there's like scarring there. You see these red bumps and everything pop up.
Oh, okay.
So yeah, when there is no scar tissue, the tool should go very smoothly.
Yeah.
But when you have a lot of scar tissue, it's just those like feel like rocking away.
Yeah.
Yeah. But make sure it's pain-free, okay?
Yeah. There's no pain or that. It's just the pressure.
So Linda, tell us how easy to use or how difficult to use the ASTR instrument.
Not difficult at all.
Okay.
It's super easy. It's got to put a little work in it. Fine. I don't feel sore. I don't anything at the end of the day. My hands don't hurt. Do soft tissue.
Very gentle. Before you used to use what manual stuff you used to use?
My hands mostly and some grasping tool.
Mm-hmm.
ASTM and those at the end of the day my hands were sore, dry and crackly. It was terrible.
Okay, but with the ASTR instrument you don't feel that?
Nothing.
Yeah. And how long it took you to really be comfortable to use the instrument after taking the class?
Oh, after the class I felt much better. I tried on a couple more people since, and now that I'm getting a better feel, I'm good.
So like it took like a couple of days, a week,
I
or
would say if I were to work on vacation every day, it would just probably take like 2 days. Really.
2 days
Yeah.
to really be comfortable to use the instrument. Do you feel the class was enough practice to get the feel of it?
Yeah, especially there's a lot of one-on-one time, which is great. Our class were nice and small and intimate, so there was a lot of opportunities for questions and answers. Yeah, it was a really nice class.
Yeah.
I recommend it.
Yeah, awesome. Thank you. All right, so after breaking that, we're going to clean up and then we'll check your range of motion. We'll leave that like the gown intact, so if we need to come back, if he did not get the full range of motion. So we're going to do the same exact range of motion we did before to see how you're doing. How's that?
Right there. It's lower.
Yeah, before you were touching the...
Like halfway through my socket.
Okay, and then let's go backward. Any pain, discomfort? It's okay.
No. My
Side
body's
bend?
still moving. Like
You have more flexibility, yeah?
Yeah.
Okay, and let's do the side bend. That's nice, look at that. You going down, yeah.
This one's going down.
Beautiful. Do the other side. No sharp pain going down?
No, no, sure.
Still have some a little bit restrictions here. Okay, so let's lie on your side again. Okay, we're gonna use A4, A3 on his hamstring, the same instrument.
The same.
Yep, the big one. Yep.
That's amazing.
Actually, when do you hamstrings? More like
No, the same position. We'll just get his hamstring. Yep, and IT band. So with ASTR, we actually do a lot of reassessment to see how patients respond to the treatment. And the protocols are provided in the class with the instrument and everything. How does feel on your IT band?
I could feel like, I guess the scar tissue itself.
Yep, it's
Compared
bumpy.
to the ones that I have here,
Mm-hmm.
they're a lot bigger than there.
Yeah.
The ones are a lot
Mm-hmm.
bigger.
Yep. And you said you've been doing the stretches. You've been doing foam roller, but you still have the issue.
Yeah.
Yep. So with ASTR, we actually try to look at, based on patient presentation, to ask the question, why there is a symptoms, why patient experience that pain. And instead of doing stuff to address the symptoms, we try to get to the root of the problem. So we barely do any stretches here, or we just try to figure out, is it like scar tissue, it's a fibrosis, fascia restrictions, is it muscle spasm, is it trigger point, is it something else, alignment issue. So that's part of the holistic approach of ASTR, to figure out where is the problem coming from, and based on that we customize the treatment for patient. Our goal is to get the pain under control as fast as possible, and transition patient to neuromuscular re-education. And I don't do the neuromuscular education in the video, but that's what we do after the treatment with patient. But usually the expectation is patients start to gain range of motion, decrease pain with using the ASTR instrument, and then we utilize other neuromuscular education exercises. Okay, so after that we're going to clean it up and we'll check the range of motion. I can hear that, you feel that? Yeah. So we can see that. Let's look at it. So it's very gentle. We don't cause bruises here or pain. We disagree with this philosophy because that actually will cause more fibrosis. So let's clean that, and we're gonna reassess the range of motion again and see how you're doing. Okay, so let's do the bending again and see how is that. How is that? You tell me.
I can touch my ankles.
You can touch your ankles. Okay.
It's 1 hour.
And how'd that feel?
Feels good. To touch
Yeah.
my ankles.
Can you tell me your experience with ASTR?
So far, it's been really good.
Can you tell us your background in medical field?
Medical field, so I'm a nurse,
Mhm.
practicing nurse, and I just finished physical therapy assistant school.
Mm-hmm.
So basically my work background is I do a lot of standing, walking,
Mm-hmm.
a lot of push and pull activity.
How does it feel?
Feel loose.
Feel loose, yeah?
Yeah.
How long it takes to loosen up?
No, I haven't felt this loose in a while actually.
Mhm.
It's felt good. It's like
You know,
an instant release.
Innocence release.
Yeah.
That's our goal. That's actually one of the core value of ASTR is fast result. If the treatment is not fast, that's something we have to look for and see why there is no fast result, because that's one of our core value is to have instrument or maneuver that save time for the therapist and for the patient. Okay, stand up. Here. Get the
Give me a
full
second.
body.
Hold on.
All the way. So, like this. Okay, let's bend forward and see how far you can go down. How's that? You're almost there.
Toast.
Where do you feel the tightness now?
Like down to like
Okay. So when you come back, just come all the way like this, okay? All right. So let me work with you again. Okay. So you feel it?
I'm so amazed right now.
Yeah, you can. So hopefully, well, our goal is actually to help therapists to have an instrument and tools to get fast result with their patient instead of using stretching and stuff that's really basically studies showed it's not really very long-term effective, like to relieve pain. Or so our goal is to provide fast long-term pain relief. You feel that?
I feel it tight. It's like
You feel the tightness?
Yeah.
You feel the tightness? Okay. I'm gonna use other instrument. Yeah. I'm using A1 to release tension, sharp restrictions. And in the class you will learn how to use it with the protocols and everything. Everything is written down. There will be a lot of time to practice, enough to make the therapist very comfortable to start work the next day on patient. Okay? Stand up. You get the full body. How's that?
touch the floor.
So when the last time did you do that?
10 years ago.
10 years ago, yeah.
Yeah.
Now, let's do it like 10 times. Any pain, sharpening, going down?
No, I'm just feeling like a pull,
Mhm.
but like stretching pull.
Well, I think that's a, yeah, keep going. So this is not a placebo effect. They've been doing it 10 times now without the sharp pain. How's that feel?
Okay,
Let's do
just
the side
Just
bend.
feel the stretch.
Yeah, because you're,
Nothing on the side.
let's look like normal.
Now, I
Good.
need to lift
The other
because
side.
I shouldn't just slide, right?
Still feel some more restriction here, but
Yeah, we're
there's no
gonna,
pain.
no pain.
No.
All right,
It
extension.
doesn't feel like it because it's so little. Yeah, I know I'm turning.
Yeah. I don't feel any pull. I don't feel any crunch.
This is about
It's just
it.
I can still
Yeah,
feel
I'm
my
getting
spine
split.
just moving into place though.
Exercises like that.
Okay, so that's good. Let's have a seat and tell me what do you think about ASTR?
That's amazing. I'm still amazed. Honestly, when I heard about it, I was kind of skeptical about how when we were saying how fast it is, but I do believe it does help. It's instant relief.
Oh, yeah.
Oh. Yeah, thank you so much. We appreciate it. Thank you.
You're welcome.
Thank you.